Welcome to this Candidates Forum, sponsored by the League of Women Voters of Marin County. I am Lori Nardone of the League of Women Voters of Marin County, and I'll be your moderator. And with me as timekeeper is League member Nancy Bell. Of the 5 candidates who are running for the 3 seats on the Marin Healthcare District Board of Trustees, 3 of them are with us today. The 3 candidates here today are Dr. Larry Bedard, Melissa Bradley, and Jennifer Rinks. Thank you for joining us and the viewers. Each of the 5 candidates has been invited to make a 3-minute opening statement. Since Dr. Edward Alfrey and Dr. Brian Sue are unable to join us today, they have each submitted an opening statement for me to read for them. We will go in alphabetical order, so I will start by reading Dr. Alfrey's opening statement and end with reading Dr. Brian Sue's statement. Okay, Dr. Edward Alfrey. I would like to thank the Marin County League of Women Voters for this opportunity to make a statement as a candidate for Marin Healthcare District Board of Directors. There are a number of challenges that face Marin General Hospital and the Marin Community Clinics, and I am the right person to help guide the Healthcare District Board due to my more than 40 years of experience in healthcare, starting as a paramedic at the Denver General Hospital and now as the medical director for trauma at the Marin General Hospital. In addition, I have more than 15 years of leadership in healthcare after completing a master's degree in healthcare management in 2005 at Harvard University. One of the challenges we face at Marin General is the continued overcrowding in the emergency department, resulting in the boarding of patients in the emergency department and in ambulance diversions to other facilities. One of the consequences of boarding is the risk for poor outcome. For every 1 hour an ICU patient is boarded in the emergency department, there is a 1% increasing risk for mortality. In addition to quality and outcome consequences, the patient satisfaction is low, as evidenced by the recent patient satisfaction scores at Marin General Hospital. I know that improving flow through the hospital, known as throughput, as well as improving early discharges and better resource support to get patients placed after their need for acute care has diminished, improves flow. Additionally, better resource support to respond to surges and respond to the more than 40% of patients admitted after 7 p.m., as well as improved strategies to help throughput from the operating room and into the ICU, will improve the problem of overcrowding. In addition, using better strategies to get patients who are using the emergency department for their primary care to go to the community clinics rather than the ED will also relieve the emergency department. I participate on many important committees in the hospital and have unique insight to the problems associated with overcrowding. Marin General Hospital is the designated trauma center for Marin County. Under my leadership as the medical director for trauma, the Marin General Hospital Trauma Program has been ranked as #1 in the Bay Area for quality and outcome over the last 2 consecutive years by one quality reporting agency. I also serve as the chair for the Department of Surgery. My awards include the 2017 Legacy Award from Operation Access, which is an organization that serves the uninsured and gets these patients into the clinics for prompt care of their medical and surgical conditions before they become seriously ill. Once they become seriously ill, their cost of care increases dramatically. I've been selected by my peers into Marin Magazine's top doctors consecutively for the last 5 years. And I'm out of time. So now for the opening statements of the candidates who are with us today. We will begin with Dr. Bedard and then, am I saying that right?
Yes, Dr. Bedard.
And then proceed in alphabetical order.
I'd also like to thank the League of Women Voters for sponsoring this event. This is my, hopefully, 5th term on the Marin Healthcare District Board and last term. I've been involved at Marin General Hospital both as an emergency physician and a physician leader for more than 40 years. In 1981, I became the first board-certified emergency physician to practice in Marin County at Marin General Hospital. I was chairman of the Department of Emergency Medicine for 8 or 9 years. During this time, I played a major role in setting up the EMS programs in southern and central Marin. I was reelected to this board in 2006. At that time, there was tremendous contention with Sutter's management of the hospital. At that time, I think we successfully negotiated a break with the Sutter health system. Dr. Rinks and I, whom I support, came at this from a different perspective. I think we've learned to come to common understandings about the issue, and we have been a very effective team. And August 24th, Marin IJ, Sunday edition, Dick Spotswood had a column about let's not overlook some of Marin's success stories. The story he focused on was the success at Marin General Hospital. He said there were 3 keys to our success. In 2010, we separated from the Sutter Health System. At that time, I was chairman of the board. Prior to our separation, we agreed to set up a separate board to operate and manage Marin General Hospital, and we built the firewall from the politics of the district to that of the Marin General Hospital District, or Marin General Hospital Board of Directors. There's a wealth of talented, committed community volunteers, and we have a tremendous Marin General Hospital Board of Directors. And finally, as Dick Spotswood said, we hired a first-rate administrator. I was part of the alliance, and we were able to successfully recruit and hire Lee DeMonico. What I would like to do is I think there's 2 things left. One of it is to build a modern, state-of-the-art, green, technologically superior hospital. We're on time, on budget, and I hope to be there to welcome the first patient in June 2020. In addition, we signed a partnership with Ucsf. Last year, I was the only physician that was on the San Francisco Marin Medical Society of all the candidates. I think I'm in a unique position to make this a successful partnership. Thank you.
Thank you. Melissa.
Okay, hi, I'm Melissa Bradley, and I am the owner of Bradley Real Estate. I started my business 25 years ago. I was born in Marin County. I have 4 children. They were all also born here at Marin General. I was born at Marin General. I'm very local. The reason I'm doing this is I have decided to dedicate the rest of my life to being an advocate for women and children that have been abused, and also for people that are being mistreated in a number of our governmental systems, including the judicial system, the criminal justice system, the healthcare system, etc. I decided to run for this office because I want to make a difference, and I'm using this position, hopefully if elected, as a stepping stone to further in a political career in the future. The difference between me and the other candidates is that I am not connected in any way to the medical field. I'm not a doctor, and I'm not connected to the Ucsf or to Marin General, and I'm also not a retired physician that can use this in my business. I have absolutely no financial gain or conflict of interest whatsoever, any possibility of that. Also, I actually used to have Blue Cross, so Marin General was the facility that I would use, but now I have Kaiser, so I'm also not a Kaiser member. One thing that I think nobody else is going to bring up is that I've learned through talking with a number of doctors and nurses and other people that work at the hospital that they are feeling like they cannot talk with Lee DeMonico or communicate very well with him. Lee DeMonico is the CEO of Marin General Hospital. The Marin Healthcare District Board is an oversight board which oversees the privately owned, oh, just a minute, I'm getting a call, hold on one sec. Lee? Oh, okay. Yes, I'm talking, yes. No, I understand. I'm not worried about getting sued. No, I'm not worried about getting fired. No, well, see, the problem is that, no, you have to understand people are not happy.
Okay, so, Jennifer, your turn.
Hi, my name's Jennifer Rinks, and I'm running for re-election on the Marin Healthcare District Board. I was first elected in 2006 after the deal for the separation with Sutter had been signed. I worked from 2006 to 2010 to prepare our hospital for a successful transition from Sutter Health, and we have done that. We are now a successful, freestanding, independent hospital that is run for the benefit of the community members who own the hospital. I have a PhD in social psychology, and I've been working at Ucsf since 1996. I currently head the Family Health Outcomes Project at Ucsf, and we work with the California Department of Public Health and public health departments around the state to work on improving the health of maternal, child, and adolescent health populations. That includes focusing on prevention, looking upstream at what's causing our health problems, and really finding evidence-based interventions to address them. I'm running for Marin Healthcare District Board to finish the work that we started several years ago. First on the top of the list is finishing Marin General Hospital, which is going to be a crown jewel in Marin healthcare. State-of-the-art green hospital, lots of healing environments. I think the public's going to be proud, and I thank the public for stepping up and supporting Marin General Hospital through the bond measure. My next priority is ensuring and increasing access to primary care in this community. You've heard about overcrowding in the ER, and part of that is caused by a lack of access to good primary care. We support Marin community clinics, and we need to continue doing so. We also support a number of private practice physicians in the county to help make medical care more sustainable and affordable for all. That's another challenge that we will be working on, is how to keep that access and how to expand that access. I think another issue is actually looking at urgent care as a way to relieve some of the crowding in the emergency department. But ideally, you want to get people care before they actually get so sick that they need to go to the emergency department. The emergency department's a very important resource for true emergencies, but as much as we can, we want to keep people out of the ER. I'm also working on expanding mental health access. I think that that's a big issue in Marin County. The data shows that we have a lot of mental health challenges in Marin, substance abuse challenges, and we really need to continue to support access to improved mental health services, both outpatient and inpatient care. I have been endorsed by the Marin County Democratic Central Committee. I've been endorsed by the Marin Independent Journal. I've been endorsed by the Marin Women's Political Action Committee. I've been endorsed by the Marin County Young Democrats. I've also been endorsed by all 5 members of the Fairfax Town Council, Ford Green from the San Anselmo Town Council, Catherine Ray from the Larkspur Town Council, as well as numerous physicians and nurses. I ask for your support.
Thank you. And now I will finish by reading Dr. Brian Sue's opening statement. I'm currently the community member representative to the Healthcare District Lease and Building Committee and am endorsed by Chairperson Ann Sparkman, Prior Chair Hank Simmons, the Marin IJ, Congressman Huffman, Lieutenant Governor Newsom, and recommended by the Marin Women's Political Action Committee. I came to Marin 10 years ago after training at Columbia in New York and completing a spine surgery fellowship at Thomas Jefferson. I am currently the Surgeon-in-Chief of California Orthopedics and Spine, the largest orthopedic and spine group in Marin. It's been a privilege to be named in San Francisco Magazine, 415 Marin Magazine, and Castle Connolly as a top doctor for spine surgery. Each year I see approximately 3,000 patients and perform 200 spine surgeries at Marin General. My daily interactions with patients and staff give me a unique perspective for what is needed to ensure the highest level of care at Marin General Hospital. For that reason, I was appointed to Marin General Hospital Operating Board Quality and Patient Safety Committee. I also participate in philanthropic efforts by serving on the Foundation Board, and I co-chaired the Physician Capital Campaign. Over the last year, I structured an agreement with the Marin Community Clinic to provide comprehensive orthopedic and spine care to Marin residents who are uninsured or have Medi-Cal. All patients at the clinic now have access to the same quality of care that our privately insured patients do. I live in Kentfield and can see the hospital from our backyard. I am committed to ensuring that our hospital provides world-class care and that all of you have access to that care. Marin needs someone on the district board who is not financially tied to the hospital, is familiar with the inner workings of the hospital, and has experience working with all three, operating, district, and foundation boards. I am Brian Sue and would appreciate your vote. Okay, now for the questions. The candidates will each have 1.5 minutes to answer. And to be fair, I will rotate the order in which they respond to the questions. So we're going to begin with Melissa for the first one.
Okay.
Okay. Hospitals and healthcare businesses are facing rising costs across the country. How would you propose containing those costs so as not to pass them on to consumers who are finding it difficult to afford healthcare even if they have insurance?
Okay, thanks. Well, I have researched this, and a lot of times what the hospitals are charging is quite a markup compared to what the actual cost is. And one of the things that I would do, if elected, is to really be an investigative person. I think that being that I have no conflict of interest. I don't work for the hospital. I'm not a contractor for the hospital. I'm not in any way related to it. I am not afraid to point out anything that I feel that is not being handled correctly. And my understanding from talking to doctors in the hospital and nurses that work in the hospital, that there are a lot of things that are not being handled very well, and there's a lot of systems that are not being properly taken care of. For instance, I heard like the air conditioning was out on an entire floor for a long time and the nurses were all sweating. If the employees are not happy at the hospital, then that's going to trickle down to the patients, and then the patients are not going to be happy. I know that from my own business of having over 400 employees and agents, that the employees absolutely have to be happy in order for them to do a good job for the customers. And then the customers in this case would be the patients. So I do believe that I would do the best job at that. Thank you.
And if you guys need me to repeat the question at any point, just let me know. Okay. So, Jennifer?
So that we're talking about rising costs of healthcare, which I think is actually a really big problem. In fact, healthcare is getting so expensive that people are often foregoing healthcare. They can afford insurance, but then they can't actually afford to get healthcare on top of that with all the copays. I think this is one of the major challenges that are facing this country, and one that we really need to be creative in solving. First and foremost is prevention. I work in public health, and prevention is key. Getting people to take better care of themselves and making it easier for them to do the right thing by creating the environments that make people healthy is a very important first step. We also need to look at serving patients in lower cost environments, doing what we can to move services from out of the hospital into outpatient environments, services and outpatient environments into the home environment. That reduces costs for patients, and it also can improve outcomes because they're not exposed to infections and things like that that they might be in a hospital. Another option is to make better use of technology. The electronic health record, for all its challenges, has actually done a lot to enable physicians to better monitor the health of their patients. We also need to work on patient compliance and making it easier for patients to take their medication, to make sure that they're getting to their appointments. So also looking at things like even transportation services and how those can help make patients healthier. Cost is a real challenge, and we need to do more about that. And I think another big piece is looking upstream at population health, and again, doing what we can to prevent people from getting sick in the first place. And our partnership with Ucsf is really going to expand our ability to do population health.
Thank you. Larry?
Sure. I think the long-term solution to the cost of health care is to focus on health and not on health care. For example, obesity is causing diabetes, etc. It's well known, and yet we still have commercials promoting, soft drinks with a lot of sugar in them. And I think we need, in the long run, is to have better health in people, and it starts actually in the preschool. One of the significant difference in lifespan, if you had preschool education, you on average live 9 years longer than somebody who's had no preschool education. As for what we do now, I think healthcare is very inefficient. What I'm doing, I no longer see patients as an emergency physician, but I do medical legal consulting. And you look at medical records. A patient has a CT scan in the doctor's office on Monday. His condition worsens. He comes to the ER. You have to repeat it because you don't have access to the first CT scan. So I think we really need to focus on efficiency to control cost. Also using non-physician providers, nurse practitioners, PAs. That's something that they do regularly in the emergency department. So I think there are many things we can do to control the cost.
Thank you. I'm happy to know I gave my kids 9 more years.
Yeah,
Okay, Jennifer, we'll start with you for the next question. How would you address the strain, and this kind of ties into it, the strain on emergency rooms caused by patients deferring primary care due to lack of insurance coverage, thus relying on the emergency room for non-emergency care?
Okay. Well, first thing in addressing the costs and doing that, I would say if we move to a single payer system, we would pull a lot of money out of the insurance companies and we'd have more money to actually provide health care. And if we were able to move to a single payer system and cover everybody, then we wouldn't have people that were uninsured and having to use the ER as their primary care. That would ensure access to everybody, and then I think we'd be able to do a better job giving people the primary care that they need so that they don't get sick in the first place. I also think we need to really look at expanding our urgent care facilities. There's a lot of things that people come into the ER for that aren't necessarily emergencies, even though they do want to be seen for them soon. So I think that that's another option. And further, we need to continue to work with our community clinic partners and strengthen that safety net, and also address the social determinants of health, which often lead people to having poor health outcomes. In Marin, that includes high costs of rent, high costs of living, stress, a lot of mental health stress from all the high costs that we're all facing. So that's another thing that I would encourage to address that. Emergency overcrowding is really a problem. With our new hospital being built, we are going to have a larger emergency room, but we're still going to need to do what we can to decrease people's utilization of the emergency room and get them in to be seen sooner so that they aren't getting so serious. Thank you.
Thank you. Larry?
Yeah, I think the issue of overcrowding or boarding of patients is a long-term chronic problem with emergency medicine. I'll explain. We're a victim of our success. The first overcrowding task force in the American College of Emergency Physicians was in 1990. We just had the 50th anniversary of emergency medicine down in San Diego. I'm a past president of the American College of Emergency Physicians. The two biggest issues were overcrowding and boarding. I know Dr. Elfi talked about this as a major problem. Rather interesting, he mentioned that the trauma service was given a quality award. Also, this year, the emergency department at Marin General Hospital was one of 17 in the country that got the Emergency Nurses Association highest quality award. So I think emergency care in Marin is very good. Dr. Elfi sat on the executive committee. He should be a leader and help solve the problem, but for 7 years really hasn't addressed it. I know he's never met with Lee DeMonico and John Friedenberg, who have an open door policy. And quite frankly, this is not an issue that it's in the Marin Healthcare District, the public board, to address or manage.
Thank you. Melissa?
Could you repeat the question, please?
Yes. How would you address the strain on emergency rooms caused by patients deferring primary care due to lack of insurance coverage, thus relying on the emergency room for non-emergency care?
Okay, thank you. So I've had some personal experience with this. I met a homeless man in Marin City, and I took him to Marin General a number of times because he wasn't able to get care at the Marin City clinic that he needed. And he wound up coming in there and using the emergency room for just a breathing thing that he could have got at a clinic if it had been better equipped. And I want to repeat this because it's really important for the public to understand that the position that we are all running for Marin Healthcare Board is an oversight board. It is not the board of the hospital. The hospital has its own board, and the hospital is a business. The Marin Healthcare District leases the building and the business. Leases the building to the business Marin General, and Marin General pays the board a lease amount. We are also oversight for the salary and bonuses of the executives, and it is my understanding that those executives, that many of the employees are not happy with them, and they don't feel like they can communicate with them. Also, regarding the emergency room, it's really a communication and PR thing that needs to happen where people aren't coming in for like a bug bite, etc.
Thank you. Okay, Larry, we'll start with you for the next question. What is your viewpoint on the level of psychiatric care provided by the various healthcare district facilities? And if you see room for improvement, how would you implement that?
Well, I think we're very fortunate with the psychiatric program we have here in Marin County at Marin General Hospital. One of the things as a board member, we attend the annual scientific assembly of the American Hospital Association, as well as the the ACHD, the Association of California Health Districts. There's 43 district hospitals in California. Only 6 of them have an inpatient psychiatric unit, and Marin General Hospital is one of the 6 district hospitals that have an inpatient psychiatric unit. In addition, we're one of the first hospitals that employed or offered contracts to psychiatrists. We have a psychiatric hospitalist program. They're in the hospital, available 24/7 to admit patients to Unit B. They rotate through the various primary care clinics and see patients as an outpatient. So I think this is an issue that we're fortunate of the psychiatric care we have in Marin, and this is something I think the district board supports, and I think Jennifer and I have done a good job in making psychiatric care much more available to the people in Marin County.
Thank you. Melissa?
Hi, thank you. This is one of the issues that I'm very passionate about. And I do think Marin General is lacking in their mental health, what they provide. I've talked with one of the directors of NAMI, National Alliance for Mentally Ill, in Marin County, and I've also talked with people at Buccaloo, Marin, as well as many people, probably over 25 people in Marin Health and Human Services. And across the board, people that I've talked with all feel that the psychiatric care at Marin General is substandard. I have confirmed with an emergency room doctor that there is no full-time psychiatrist at Marin General in the emergency room. There's also only 13 beds for the lockdown facilities for the psychiatric patients, and everyone that I've talked to in the mental health field in Marin County feels that that is insufficient and that the number of beds has not grown with the population. I also want to say that I'm not going to be a yes man or a yes woman on the board, as it appears my incumbents, or the incumbents here, are certainly seem like they are going along and getting along. I am going to be an investigator and get down to the heart of the matter. I'm going to represent the constituents, which includes not only the patients, but the doctors and nurses at Marin General. Thank you.
Jennifer?
Yes, increasing the number of increasing psychiatric services is a really important issue for Marin, and it's actually a really important issue statewide. And just a little correction, we actually have 17 psych beds at Marin General Hospital, not 13. But the challenge is that there's a dearth of psych beds in the entire state. And actually, Marin General is the only hospital between the Golden Gate Bridge and the Oregon border that accepts Medi-Cal patients. This places an enormous strain on our hospital. By law, Marin General has to make available a psychiatric bed to any patient that needs that, regardless of where they're from. We've got other counties that have no psychiatric beds that are sending patients to our county occupying psychiatric beds that Marin residents might otherwise occupy, and then Marin residents are being sent to other counties. It's a system that's broken, and it's a much bigger problem than Marin General's problem. I support statewide solutions to solving the psychiatric bed problem. That said, I also think, as Dr. Bedard said, we have been supporting both increasing access to outpatient psychiatry in the form of intensive outpatient psychiatry and also expanding mental health and prevention programs. The hospital and the district support a number of efforts, including the Community Institute for Psychotherapy, Buckaloo programs, Homeward Bound, Ritter Center. All of these are working on addressing psychiatric challenges on the outpatient basis as well. We have supported having psychiatric staff work full-time for Marin General. They do cover the ER. They also cover the inpatient. Thank you.
Thank you. Okay, for our next question, we'll start with Melissa. What do you see as the primary benefits and possible drawbacks to Marin General Hospital's recent partnership with UCSF Health? How do you see that integration unfolding?
Okay, thank you. So this is a newly formed alliance, and I've talked with a couple medical professionals, including a doctor, about the alliance between the two. And I also heard what Brian Sue said at another forum, and it seems like there's mixed emotions about the situation, and basically, my intention on being on the board would be to have the best care for the people. So the alliance between UCSF and Marin General Hospital providing better care is important and it is good. But I would want to investigate further to make sure that I'm being very thorough, that is the best, that all the aspects of the alliance are the best for the people that are getting the services provided for them. Thank you.
Thank you. Jennifer?
Yes, there's a number of benefits to the partnership with UCSF, and we're calling that a strategic affiliation agreement. UCSF is going to invest considerable resources into Marin General Hospital, and they're also going to bring medical expertise to Marin General Hospital. UCSF is bursting at the seams in the city, and they're looking at expanding services into nearby communities so that people don't have to just travel into the city for their care. This will be much more convenient for Marin County patients. The merger with, or the alliance with UCSF is also going to improve our electronic health record. We're going to be bringing Epic to the hospital, which is something that the doctors and the nurses have been asking for. UCSF also brings with it a special expertise in population health. So they're going to help us look at how we can better ensure the health of the population and prevent people from getting sick in the first place. Things that we need to watch out with that alliance is that UCSF is a big institution. It's an academic medical center, and we are a community hospital that's owned by the residents of the district. We need to make sure that we don't get lost in that shuffle, that Marin General is recognized and seen as important in UCSF's eyes, and that they fulfill their commitment to the hospital and the residents of this district. The hospital is owned by the residents of the district. Marin Healthcare District Board is the sole corporate member of the Marin General Hospital Corporation Board that appoints the operating board of Marin General Hospital. So we have a lot of citizens involved in the governance of Marin General Hospital, and we need to make sure that their voices continue to be heard.
Thank you.
I think the two keys to our future success is, one, having a state-of-the-art, technologically sophisticated green hospital. We're on time and on budget. I think the second thing is to have this strategic alliance or affiliation with UCSF. This is not only a trend in California, it's a national trend. In fact, at the recent Association of California Health Districts, they had a whole presentation on how you successfully emerge a community hospital with an academic medical center. And when we started out on this process a couple of years ago, we were talking both with Stanford and UCSF. Stanford was going to give us $100 million, UCSF was going to give us $70 million, and I think thanks to the negotiating skills of Lee DeMonico, and there was a whole physician committee that participated in the negotiation and evaluated the affiliation. We got $120 million. They're going to invest in Marin County over the next 10 years, starting out with $20 million to come up with the best state-of-the-art electronic medical record, the EPIC system. So I think it's really important to our success. As a member of the San Francisco Marin Medical Society, who have endorsed me, they also endorsed this affiliation with UCSF. So I think the physicians think it will improve the care for their patients.
Thank you. Jennifer, we'll start with you for our next question.
Okay.
What are your thoughts on encouraging physicians to embrace virtual care, and are you a proponent of that?
I think in many cases that can be incredibly helpful, especially in areas where there is less access to physician services, especially like in the northern part of our state. We have real challenges with that. I think you have to watch what kind of care you do with telehealth. Kaiser's done a lot of good work with that, and I think that there's a lot of good work that's being done. Psychiatric consultation over the phone can be very helpful. It can be easier for patients to make appointments and keep appointments if they can do it over the phone or they can do it via video and conferencing. Patients don't always actually have to be seen with physicians. So I think it's a way that we can reduce costs and maybe improve quality as well by getting people access sooner. Sometimes getting in to see a specialist can take a really long time. So providing people other options or other ways to access that medical technology, I think, can be very helpful. To the same extent, we also want to make sure that people who do need to be seen in person are actually getting that care and they are being seen in person. But one of the challenges that healthcare is facing, and so is Marin General, is that we've got an aging physician workforce and we're going to need to be recruiting more doctors. In certain areas, there's very few doctors, so we need to look at doctors and medical professionals as resources and figure out how we can best utilize these resources across our state. And I think telehealth, virtual medical appointments is a big part of helping to solve that access challenge.
Thank you.
When I was chairman of the board of the California Emergency Physicians, I started the telemedicine section with ACEP. And my partnership, we had rural hospitals, and it's critically important that you have a radiologist read a CT scan of the head if they're having a stroke before you give them clot-busting drugs. If they're having a bleed, you could kill them. UC Davis probably has one of the most comprehensive, best virtual reality programs in the country, and they link to a lot of rural hospitals. In a center like we are, a suburban center, actually the first telemedicine was done by psychiatrists in Boston who were seeing patients in the prison, and they would have to take them over the river, and the psychiatrist set up. We serve a San Quentin hospital. I think having psychiatric telemedicine available to our patients at San Quentin would be advisable. I do think it also really cuts down cost. You're seeing more and more advertisements where you can call a nurse, call a doctor. With Skype, you can have a face-to-face conversation and get your sore throat or sprained ankle appropriately treated.
Great. Melissa.
Hi, this is one of the things that I researched, and it's just, it's kind of state of the art and what most hospitals are moving toward. More care either going toward the people or communicating via telephone or Skype or whatever. But the point here is, I need to make this again, is this board that you're voting for is not a business. This is an oversight board. The business, Marin General Hospital, has their own board and their own executives, and Lee DeMonico is the CEO. Those are the decision makers. So all these things that we're talking about the board that you're voting for is not making the decisions on. We can make recommendations, and that's what I would intend to do. I would also be someone that would question things, which I read through the notes and the meeting notes, and it doesn't seem like very many times questions were asked, or at least it wasn't noted. I do think that these board meetings should be televised. They should be videotaped, just like the Marin County Board of Supervisors meetings are videotaped, so that the public knows what's going on in the meetings. And I do believe we need at least one member that is not in the medical field, that is not afraid to stand up and ask the questions and to investigate the situations and to be a representative of not only the constituents that are the patients, but also the doctors and the nurses at the hospital.
Thank you. Okay, we'll turn to Larry for this question. What are your thoughts on the fact that there's no facility in Marin that does rape kit evaluations, which forces rape victims to be driven to Vallejo?
I'm sure I'm the only person on this panel that has actually done rape examinations. Early on, it was done by emergency physicians, and I've probably done 8 or 9. I always, in my mind, thought, gee, this is the second assault this woman's going to experience tonight, because you're in as an emergency physician doing a rape exam, you got to leave, somebody with chest pain come in. It's not the right environment. And what we did in Marin many, many years ago is set up SART teams, sexual assault response teams. Turns out last year we only had 8 rape victims in Marin that were transferred or asked to go over to Vallejo. This is a very technological legal examination. It's best done by people who do it regularly in a calming environment. So I think with the 8 cases we have here, I don't think they're going to be best served by us trying to restart our own SART team. I think not only does Kaiser Vallejo serve Marin County, they serve several other counties because of the nature, the complexity, and the importance of this examination.
Okay, thank you. Melissa?
Okay, so I want to make clear that was a joke earlier when I was taking the call from Lee DeMonico. That wasn't really Lee, that was a joke. I just want to make sure everybody knows that. Regarding the rape kits, I do agree that we should have them in Marin County. But again, this is not something that correct me if I'm wrong, but I didn't see this in any of the notes in the minutes of the meetings. And I don't think most of these issues are being brought up. I think, you know, these are all great issues that we're talking about here today, but they're not issues that are being brought up for the most part during the meetings. And that's a reason why these meetings, following the Brown Act, I think they should be more open and public. And I do believe all these meetings should be televised. The Marin Healthcare District meetings should be recorded and televised, just as the Marin County Supervisor meetings are recorded and televised, so that the public really understands what's going on. And they can see that from my understanding, that we've got a bunch of yes men and women on the board right now, and we need somebody that's going to investigate things and, you know, really get down to the heart of the matter and represent the constituents, which includes the doctors and the nurses who are working hard to take care of the patients at Marin General Hospital.
Thank you. Jennifer?
Yes, if Melissa had actually come to one of our board meetings, she would know that we actually do record the board meetings. They're not videotaped, but there are audio recordings of those, and they are available on our website. And I do encourage people to listen to them. I encourage people to come to our meetings. We have very few people that ever show up anymore in our meetings, probably because things are going smoothly and they're not contentious like they used to be. But I do encourage folks to show up and see what happens in person. Now, on that very important issue of the rape kits, Larry is right that there There are, fortunately, luckily, not that many rapes in Marin, and we also want to ensure that the people that are doing these examinations are doing them regularly and have a lot of experience doing them. You really want somebody who's skilled doing this, not somebody that does it once every couple of months. That said, it's not a decision of the hospital or the healthcare district. This is a decision of the county. And District Attorney candidate Anna Pletcher has actually come up with a novel solution, I think. She's talked to the people that do these exams, and she's asked them if they would be willing to come to Marin General Hospital to see these patients as opposed to transporting the patients to Vallejo. I totally back that idea. I think actually transporting the rape examiners to the patient, to the victim, and not making the victim travel is a novel solution. I think you're bringing people who have the expertise and the ability to do those very challenging exams in a sensitive way that doesn't further traumatize the woman. So I think that that's a really great solution. We have to think outside of the box, and I think that that's a great solution to that challenge.
Okay, we're going into our last question here. And Melissa, we'll start with you. What are the principal unmet healthcare needs of undocumented immigrants residing in Marin County? And how do you propose to address those needs?
Okay, so undocumented people are, my understanding from talking to some doctors and nurses, that undocumented people are sometimes scared to come in for medical help and then into the clinics, and then they wind up coming into the emergency room and it clogs up the emergency room. But again, these things, and Jennifer, I was really thorough on going through the Marin Healthcare District website. If those audio recordings of the meetings are on there, they're not obvious to someone that wants to find them, because I've looked on that website very thoroughly. In fact, the board meeting minutes are hard to find, and I believe that you're the secretary right now, and the minutes, in my opinion, are pretty sparse. I also want to say that I did notice that 2 of the current board members are not, and I have documentation of this in writing, they are not up to code with their continuing education for fair political practices. I'm not sure exactly what the wording is, but for their education of the continuing of the understanding of the importance of how they represent the community, including the Brown Act violations that I believe are happening.
Okay, thank you. Jennifer.
Melissa, I think you're referring to ethics training, which is AB 1342, I believe, or 1234. Anyway, I am up to date on my ethics training. I have attended that. I have done that regularly. And our meetings are actually recorded, and you can find them on our website. And I'm happy to help you. And we can always improve our website. Websites can always stand improvement. So I will say that said, though, onto the important issue about the Canal community, or the undocumented community in Marin, who primarily does live in Canal. That community faces a lot of challenges, particularly with the current administration and their attack on undocumented people in our country. These people need access to mental health services, especially since things have gotten so stressful for them. They need access to primary care, they need access to specialty care, pediatric care, and they need access to prevention care. We also need to work with the Canal population and the undocumented population to really address the social determinants of health. That means improving educational opportunities. We've heard earlier about the big impact that preschool can make. So we need to work on actually improving family and community health, getting children into preschool, ensuring that people stay in school, supporting them as they do that, helping the undocumented people find a path to citizenship, helping them find jobs that pay livable wages, and ensuring that they do have access to the health care that they need, particularly preventative health care, so that we can improve their quality of lives and that they won't be at a disadvantage and not be able to access the care that they need.
Thank you.
Yes, I think we should designate Marin General Hospital as a sanctuary hospital. I contacted the California Hospital Association, and they do have a policy which simply recognizes federal law, the Emergency Medicine Treatment Act of Labor Act, which says any person has a right to go to an ER and be evaluated to see if they have a significant medical condition. I was the ACEP president that was most responsible for the passage of this law, EMTALA, which was amended in 1989 to make on-call physicians responsible physicians. The biggest concern is I think many immigrants are afraid that they're going to be turned over to an ICE official or that we're going to call somewhere else. And actually, Marin County, when Governor Wilson had his initiative, anti-immigrant initiative, really started at the Marin Healthcare District Board when Rick Ottman came in and demanded the names and numbers of all the illegal immigrants we saw. One of my proudest things as a physician is I got the CMA to oppose that initiative and actually wrote a letter to the California Supreme Court pointing out how it was unconstitutional because it violated federal law. So immigrants, legal, illegal, whomever, wherever, you're welcome 24/7 in the emergency department at Marin General Hospital.
Thank you. This concludes our questions. Before the candidates make their closing statements, here's some useful information about the election. Election day is Tuesday, November 6th. If you wish to register to vote, or if you've moved since the last time you voted and you need to re-register, you can do that online, or you can mail in your change as long as it's postmarked by October 22nd. Vote by mail requests must be received no later than October 30th. If you go to the League of Women Voters Voters Edge website at votersedge.org/ca, votersedge.org/ca, and enter your street address and zip code, you'll be able to see your own ballot with links to the candidates, issues, ballot measures, and information about the voting process itself. It's a terrific tool in helping you make sure you have your voting plan in place for this election and every election. So now the candidates will make their closing statement of 2 minutes each, and we will start with Jennifer.
Thank you. I'd like to thank the League of Women Voters for putting on this debate. I think it's things like this, bringing democracy and working democracy, is more important now than ever. I want to remind you of my qualifications for the Healthcare District Board. I was first elected in 2006 and have been re-elected 3 times since then. I'm up now for my 4th re-election. Healthcare is complex, and you want somebody that's knowledgeable, qualified, and has the experience to represent the public on this board and to act in the public's best interest. Marin General Hospital belongs to the public. I am a collaborative politician, not politician. I'm a collaborative board member, but I'm also not afraid to stand up and speak my mind and go toe-to-toe with the hospital administration. I'm an advocate for patients, I'm an advocate for public health, and I'm an advocate for you. Marin General Hospital is going to be facing increasing competition from other hospitals, rising costs, and we're going to need to do what we can to ensure that our hospital remains viable. We're going to need to recruit the next generation of physicians to replace the physicians that are retiring, and the UCSF affiliation is going to help with that. We need to expand access to primary care. We need to support our primary care physicians, and we need to ensure that everybody gets the health care that they need at the right time, the right place, and for only a nominal fee. I support big policies like moving towards single payer. I support increasing psychiatric beds statewide and doing what we can to improve the health and well-being of Marin citizens now, increase their lifespans, address the social determinants of health, and address the mental health care challenges that we are all facing in this community. Thank you. I ask for your vote, and I remind you I've been endorsed by the Marin Independent Journal, the Marin Central Democratic Committee, the Marin Young Dems, the Marin Women's Political Action Committee, and numerous elected officials and doctors and nurses. Thank you.
You know, Woody Allen once said 90% of life is showing up. And I've been showing up as an emergency physician, a patient advocate, and a community leader for the past 40 years. As Jennifer mentioned, she and I were both elected in 2006. So in those 12 years, Melissa Bradley has never showed up to a single Marin Healthcare District board meeting. You talk about we're yes people and we don't, issues we don't discuss. It'd be nice if you actually showed up for a meeting, Melissa. In addition, in the last couple of years, we put on educational programs for the community. We had one on opioids. We've had them on psychiatric. Once again, Melissa has never shown up. Just like Melissa has never showed up, Dr. Elfie has also never showed up in his 7 years at Marin General Hospital, Chief of Trauma Care. So Jennifer and I clearly have showed up, and we were going to run as a slate, which would include Brian Sue, because Dr. Sue, believe it or not, has shown up for Marin Healthcare District board meetings. He sits on one of our community member in one of our task force. So I would recommend that you vote for Jennifer Rinks, Larry Bedard, and Brian Sue. The hospital is doing well. We need to keep on our successful path with building a new hospital. Open up January or June 20th in 2020. And furthermore, the affiliation with UCSF is really going to be in the best interest of patients here in Marin County. I'd appreciate your vote.
Thank you. Melissa.
Hi, thank you. So, Mr. Dr. Larry Bedard, I have not shown up at the meetings because I just decided to run for this and I didn't know about the Marin Healthcare District very much before I decided to run. I'm using this position, if elected, to not only represent all the constituents in Marin County, which Jennifer Rinks at a recent Women's Political Action Forum said that she only wants to represent the patients and not the doctors and nurses. You can go back and look at that video to confirm what I'm saying. Also, I want to say that I do believe you guys violated the Brown Act because you just told me that you, Dr. Sue, and Jennifer Rinks all decided to run as a slate. It is a violation of the Brown Act to do that without making it a public open and public, and you guys decided to do that as a slate prior. Yes, that's a violation of the Brown Act. If you guys did something and you didn't disclose it to the public, that's a violation of the Brown Act. I also want to say that you have boilerplate statements in the voters' guides. You said that you want, the reason you're running is that you want to see out the finishing of the construction of the hospital. That's going to happen whether you're on the board or not, and it was going to happen whether you were on the board or not. It has nothing to do with you being on the board. The construction is going to happen. And by the way, I wonder why we didn't hire a local builder or a local architect for this about $600 million worth of new construction. If you hire me, if you elect me as your representative, I'm not going to be afraid to stand up. I'm not going to be afraid to do the things that need to be done in order to make the Marin Healthcare District the best district. Thank you.
Okay, this concludes our forum. Thank you to the candidates for participating and Nancy Bell for timekeeping, and to all of you for watching and most importantly, voting. Thank you.